Hello, and welcome to the 2026 Annual Enrollment Presentation for Non-Medicare Retirees. This presentation will go over plan year updates, your responsibilities, your 2026 plan options, how to enroll, wellness and disease management options, term life insurance information, and contact information. For 2026, Louisiana Blue, Pelican, and Magnolia plans will see a premium rate increase of 7.75%. This is effective January 1st of 2026 for all classifications. There will be a new pharmacy benefit manager for the Louisiana Blue, Pelican, and Magnolia plans. And there are two new parishes for the Magnolia local plan. St. James and Terrebonne parishes will now be participating in the Magnolia local plan. If you wish to remain enrolled in your current OGB health plan for 2026, no further action is needed. Let's talk about your responsibilities as an OGB plan member. During annual enrollment, you can switch to a different OGB health plan. You can decrease your OGB term life insurance to basic or drop it entirely. You can add or remove dependents, or you can discontinue your OGB health coverage. It is important to note that if you drop your OGB health coverage in retirement, you will not be able to re-enroll in the future. Now let's take a look at your 2026 plan options. Non-Medicare retirees can choose one of four self-insured plans through Louisiana Blue. Those plans are the Pelican HRA 1000, the Magnolia Local Plus, the Magnolia Open Access, and the Magnolia Local Plan. Now let's take a look at some videos about each of these plan options.
The Pelican HRA 1000 health plan has the second lowest monthly premiums of any OGB plan. It offers a health reimbursement account, or HRA. You can use it to pay for health expenses like coinsurance and copays. OGB will fund a set amount in your HRA, about half of your deductible, and use it to pay for your out-of-pocket medical expenses. When you get care, Blue Cross will get the bill and use funds from your HRA to pay your portion. When all the money in your HRA is used up, you will get the bills to pay out-of-pocket. Any money left over in your HRA at the end of the year stays in your HRA, as long as you remain with the Pelican HRA 1000 plan. This plan has a deductible. Once you reach this amount, OGB will pay 80% of your healthcare costs for in-network providers. It has an out-of-pocket maximum. When you reach it, the plan will pay 100% of your qualified care. This guarantee helps you know you won't pay more than a certain amount for health care during the plan year. Pelican HRA 1000 uses Blue Cross's large, statewide preferred provider network. And you can access the Blue Cross Blue Shield Association national providers. Pelican HRA 1000 also offers out-of-network coverage, which can be helpful if you travel or need highly specialized care. OGB members who are active employees or retirees can choose Pelican HRA 1000.
The Magnolia Local Plus has the second highest premiums of the OGB health plans. But in exchange for higher upfront cost, it offers set out-of-pocket costs, which could be lower than other plans. In Magnolia Local Plus, many covered services offer co-payments. This will keep what you pay at the doctor's office or other facilities predictable. There are some services that use co-insurance, including diabetes treatment, dialysis, emergency medical services, and durable medical equipment. These services are subject to a small deductible for active members. Once you reach this amount, OGB will pay a large portion of your healthcare costs for in-network providers. There is no deductible for retirees who retired before March 1st, 2015. Magnolia Local Plus has an out-of-pocket maximum. Once you pay this amount in copayments and coinsurance, OGB will pay for 100% of your qualified care. This guarantee helps you know you won't pay more than a certain amount for healthcare during the plan year. Magnolia Local Plus uses Blue Cross's large, statewide preferred provider network. And you can access the Blue Cross Blue Shield Association national providers. Magnolia Local Plus does not offer out-of-network coverage. OGB members who are active employees or retirees with or without Medicare can choose Magnolia Local Plus.
Magnolia Open Access combines moderate deductibles with a nationwide network to make it an attractive plan for members who live out of state or travel regularly. However, premiums for the Magnolia Open Access plan are higher than OGB's other plans. Open Access differs from the other Magnolia plans. In Open Access, you will not pay copays at healthcare provider visits. Instead, once you meet your deductible, you will pay coinsurance for most services. Along with a moderate deductible, Magnolia Open Access offers reasonable out-of-pocket maximums to help keep your out-of-pocket costs lower. When you reach your out-of-pocket maximum, OGB will pay 100% of your qualified care. Magnolia Open Access uses Blue Cross's large, statewide preferred provider directory, the Blue Cross and Blue Shield Association National Providers Directory, and out-of-network coverage. Some OGB members can be eligible for Retiree 100 as part of Magnolia Open Access. Retiree 100 coordinates with Medicare to offer additional coverage for extensive hospital bills and physician charges. Members must have Medicare Parts A and B and very high medical costs. OGB members who are active employees or retirees with or without Medicare can choose Magnolia Open Access.
Magnolia Local combines lower monthly premiums with set out-of-pocket costs to create an exciting option for OGB plan members. We can do this by offering select networks powered by the state's largest healthcare providers, Ochsner Health Network, Christus, Baton Rouge General, and the Baton Rouge Clinic. In the Magnolia Local plan, many covered services offer co-payments. This will keep what you pay at the doctor's office or other facilities predictable. There are some services that use coinsurance, including diabetes treatment, dialysis, emergency medical services, and durable medical equipment. These services are subject to a small deductible for active members. Once you reach this amount, OGB will pay a large portion of your healthcare costs for in-network providers. There is no deductible for retirees who retired before March 1st, 2015. Magnolia Local has a low out-of-pocket maximum. Once you pay this amount in co-payments and co-insurance, OGB will pay for 100% of your qualified care. This guarantee helps you know you won't pay more than a certain amount for healthcare during the plan year. Magnolia Local is available to active employees and retired OGB members who live in the New Orleans and North Shore area, Lafayette and Acadiana, and Caddo and Bossier parishes. It is also available to members in the Baton Rouge area. Magnolia Local does not offer out-of-network coverage.
As we mentioned at the beginning of this presentation, Livinity will become the Pharmacy Benefits Manager for OGB effective January 1st, 2026. They will be the Pharmacy Benefit Manager for the Pelican HRA 1000, Pelican HSA 775, Magnolia Local Plus, Magnolia Open Access, and Magnolia Local Plan. You will continue to be covered by CVS through the end of this year, and you will receive a Livinity welcome packet by December 31st of 2025. If you have questions about Livinity, you can call them anytime. They are available 24 hours a day, 7 days a week, 365 days a year. You can contact them at 833-925-2770 or you can email them at support@levinity.com. You can also choose to download their mobile app, which offers the same features and information as the member online portal. Scan one of the QR codes here on this screen for the appropriate app. Want to learn more? Explore your health plan options by visiting the OGB Annual Enrollment website at annualenrollment.groupbenefits.org. There you will find the enrollment guide for plan year 2026, as well as other information available to you about your 2026 benefits. Now that you've learned about the plans available to you, let's learn about how you can enroll. Retired employees may enroll or make changes through one of the following options. If you're enrolling in a new health plan with the same covered dependents as 2025, you can use the OGB Annual Enrollment Portal, you can use the Annual Enrollment Form, or you can reach out to OGB. If you are going to enroll in a health plan with different or new covered dependents than 2025, you will need to reach out to OGB. If you would like to decrease to the basic or enhanced basic term life options, you'll need to reach out to OGB. And if you would like to drop your OGB health and or life coverage, you need to contact OGB. Again, if a retired employee discontinues their OGB coverage, they cannot re-enroll in OGB coverage. So if you plan to keep the same covered dependents as in your 2025 plan, you are eligible to use the Annual Enrollment Portal to make your 2026 health plan selection. To do so, visit annualenrollment.groupbenefits.org and follow the links to the Annual Enrollment Portal. Once there, you will log in by entering your last name, your date of birth, the last 4 digits of your Social Security number, and your zip code. Before you are able to proceed any further, you will need to verify that your contact information is correct. Next, you will select your health plan. Once you've selected that health plan, you will review your choices and click Confirm to save and view your confirmation page. However, if you made a mistake and need to make a change, click the Change button and go back and revise your selections. Be sure to print, email, or save a copy of your confirmation page for your records. At the Office of Group Benefits, your health is our priority. We're proud to offer a variety of wellness and disease management programs to support your well-being. They are Louisiana Blues Care Management Program, Disease Management, Diabetes Care, Omada Health, Blue 365, Live Better Louisiana, and Access Today Health. These programs are designed to help you take control of your health, manage chronic conditions, and live your best life. Now here's a few videos that explain each of these options.
At Louisiana Blue, we know you are stronger than any disease or diagnosis.
Our health coaches can help if you have chronic diseases like asthma, heart disease, or diabetes, rare conditions, high-risk pregnancy, organ or tissue transplant, serious injuries, cancer, obesity, depression, and more. Health coaches offer personalized support, information, and encouragement for your specific health needs. We have nearly 200 in-house clinical professionals, including nurses, dietitians, and social workers. Our health coaches will offer tips to stick to the treatment plan your doctor made for you, work with you on areas where you want to make changes, such as quitting smoking, exercising, eating healthily, or getting preventive care. Send you preventive and wellness care reminders. Work with you and your doctor's office to coordinate care to make it easier for you to find in-network providers for services you need. We have other care management programs available to OGB members as well. OGB members who are pre-diabetic may be eligible for Omada, a 16-week diabetes prevention plan. This digital care program uses proven behavioral science and rich data science to help members lose weight and make healthier choices. All OGB members can take advantage of Blue 365 Premier Health and Wellness discounts. Save on a healthier lifestyle with deals on gym memberships, healthy eating options, financial health, and more. Let's take this journey together.
Live Better Louisiana is OGB's game plan for better health. The Office of Group Benefits and Louisiana Blue sponsor LBL at no extra charge to you. In fact, it can save you money. All primary members, active and retired, with OGB Louisiana Blue health plans can get a Catapult Health checkup through Live Better Louisiana. Members of OGB's Medicare Advantage employer plan cannot take part. You can earn a $120 a year credit on your OGB Louisiana Blue premiums for the next plan year if you complete your Catapult Health Clinic checkup or get a checkup with your primary care doctor and send in a completely filled out PCP form. Clinics are scheduled across the state. You can see them all at timeconfirmed.com/OGB. For more information on Live Better Louisiana, the premium credit, or to download a PCP form, go to lablue.com/OGB, select your health plan, and click Wellness.
Are you a retiree who has health coverage on one of the following OGB health plans? If so, OGB has included an exciting add-on benefit that is 100% paid for by the Office of Group Benefits. This benefit is a VIP clinic membership to any Access Today health clinic location. You're already enrolled, which means absolutely no paperwork or application for you to fill out. This unique benefit is an option for retirees that will save you time and money, giving you fast and easy access to basic primary, urgent, and preventative care services. So what are the benefits of your Access Today clinic membership, and how does it work? Access Today members receive VIP treatment. There are no copays, no out-of-pocket expenses, no appointments needed, no long wait times, no insurance hassles, and no paperwork. Now you know what all the buzz is about and why thousands of OGB members give the Access Today program a 98.7% satisfaction score. As a retiree, there are a few important things you need to know about your Access Today clinic membership. First, your Access Today membership will not interfere with your health insurance or Medicare benefits in any way. Second, you'll want to make sure you keep your regularly scheduled PCP visits. Access Today does not replace your PCP. Third, you'll still have the same options for care that you've always had. This is just another option for care for you, and one that many retirees enjoy. Since 2019, thousands of retirees have made their Access Today clinic membership their first stop for care for unexpected illnesses or accidents. Lastly, in Louisiana alone, there are over 90 Access Today clinic locations, and you can visit any one of those at any time for care. When you're traveling, you can have peace of mind knowing that quality care is close by. There are also clinics in Alabama, Mississippi, and even Texas. We've all experienced the frustration of having to wait days or even weeks for a medical appointment. And you probably have experienced the inconvenience of an unforeseen accident or sickness on a weekend, like a small finger cut while cooking in the kitchen or coming down with a bad cold and fever. But with your Access Today clinic membership, you have the option to get same-day care at zero cost without needing an appointment. Simply walk in. Retirees have told us that they love not having to wait long to get basic treatment for primary and urgent care conditions, such as respiratory conditions, sinus infections, allergies, colds and coughs, flu and fever, and much more. Services also include general x-rays, some vaccinations, general lab screenings, minor cuts, routine checkups, and additional services. Let's hear what retirees have to say about their Access Today membership.
The care from the clinic was wonderful for my allergies. I didn't even need an appointment, and there was no copay. Plus, I was in and out in about 45 minutes.
When you go to an Access Today clinic, simply show your insurance card and identify yourself as an Access Today member. You can also show them your Access Today membership card. Don't have one? No problem. You can call Access Today Health at 1-800-797-9503 and we'll send you one. Remember, if you don't have a membership card, you can still get service if you need care. Simply identify yourself as an OGB Access Today member when you arrive at the clinic. And one more thing, many retirees go to Access Today clinics to get their Live Better Louisiana annual wellness checkup to receive their $10 monthly premium credit. Remember, this is for retirees only, not their dependents. And that's all the buzz about Access Today. Thank you for your time, and you can thank OGB for providing you with your Access Today clinic membership.
Now let's look at our term life insurance program. There are 3 fully insured term life insurance products available to OGB members through the Prudential Insurance Company of America. These are for employees and retirees, and dependent coverage is included. The state pays 50% of the premium for the employee or retiree. The employee must pay 100% of the dependent care premium. This is a term life insurance policy. This is pure risk protection. There is no cash value. Your benefit is paid if death occurs during your coverage. This plan is designed to protect, not to build savings. Here are the details about the basic, enhanced basic, and basic plus supplemental plans, and the corresponding amounts of dependent insurance offered. They are the basic life, the enhanced basic life, and the basic plus supplemental, and each one has a high coverage and a low coverage option. Plan members enrolled in the term life insurance coverage will experience automatic coverage adjustments based on their age. A 25% reduction in coverage will occur on January 1st following your 65th birthday. An additional 25% reduction will take place on January 1st following your 70th birthday. Premium rates will be adjusted accordingly to reflect these changes. For updated premium rate sheets and additional information, please visit the OGB website, info.groupbenefits.org/life-insurance. If you need to get in touch with the Louisiana Blue or Lavinity, these are the ways you can contact them. For Louisiana Blue, it is 1-800-392-4089, or you can visit their website at www.lablue.com/OGB. For Lavinity, it is 1-833-925-2770, or you can email them at support@lavinity.com. If you need to talk to someone with OGB, our customer service line is 1-800-272-8451 and select option 6. We are open Monday through Friday, 8 a.m. to 4:30 p.m. You can also email us at ogb.customerservice@la.gov. We are located in the Clayroom building, which is in downtown Baton Rouge behind the state capitol. That is 1201 North 3rd Street, and we are in Suite G159. We also encourage you to follow us on social media. On X, formerly known as Twitter, we are at OGB Louisiana. On YouTube, we are State of Louisiana Office of Group Benefits. And on Facebook, we are Louisiana Office of Group Benefits. You can also find a wealth of information about OGB on our websites, info.groupbenefits.org or annualenrollment.groupbenefits.org. Thank you for watching this presentation today. Again, if you have any questions, please feel free to reach out to OGB Customer Service.